Hello and welcome to the Centre for Independent Studies YouTube channel. My name is Jeremy Sammut and I'm a research fellow here at the Centre. I'd like to spend the next few minutes telling you about a new report that has been written by myself and David Goodell. It's called How the New South Wales Coalition Should Govern Health, and it discusses the reform strategies that will increase the efficiency of the high cost and poor performing New South Wales public hospital system. Mounting public concern about public hospitals contributed to the record defeat of the Labor government at the state election in March 2011. But despite the overwhelming mandate for change the coalition received, the health policy of the O'Farrell government has reinvented the former government's flawed policies. In New South Wales at the moment, an administrative reorganisation is being overseen by Health Minister Gillian Skinner. The coalition has abolished and replaced the 8 area health services that formerly span the state with smaller health districts. The government maintains that its overhaul will restore local control over health services and address complaints of excessive bureaucracy and centralisation. This is a real problem because for the past 30 years, New South Wales public hospitals have functioned as de facto branch offices of New South Wales Health. Yet as our report shows, the coalition has simply established a system of 15 local health districts that is virtually identical to the 15 local health networks that the Keneally government established in 2010 as part of the Rudd government's national health reforms. Now our point is that despite a lot of talk about restoring local control, the coalition policy means that New South Wales Health will continue to micromanage hospitals throughout the state. The flaw in the coalition's policy is that LHDs could only have real managerial independence if they were truly financially accountable. New South Wales Health will have to exercise tight control over the districts to prevent budget overruns, which otherwise the state government will ultimately be responsible for funding. The alternative policy that we propose is for New South Wales to adopt the approach taken in England. Over there, public hospitals are run by foundation trusts that have real managerial independence because their solvency is not underwritten by the UK government. For local health districts to have the same independence, they would have to be given the power to borrow to fund their own activities and be expected to commercially manage their services. However, this is not possible under the coalition's revamp, given that the statewide terms and conditions on which doctors and nurses and other clinical staff are employed in New South Wales is said to remain a state government responsibility. These highly rigid terms entrench restrictive work practices, such as prescribed nurse-to-patient ratios, and limit the scope of hospital managers to increase productivity and meet budget and service targets. One way to start to break this rigid model that we propose is for the coalition to revisit the issue of privatisation by using privately financed projects to deliver public hospital care. A private operator that was willing to accept full financial and managerial responsibility for a public hospital should also be granted full control over the flexible terms on which they choose to employ clinical staff. For a long time, the New South Wales health system has provided government guaranteed jobs to health workers at attractive wages and conditions. However, the productivity boosting reforms that we propose can no longer be delayed. Health already consumes a third of the state budget, and spending is growing so fast that health will consume the entire state budget by 2033. Our policy recommendations are bound to attract criticism from the usual suspects in the public sector. But if people want to call our plan for health reform the work choices solution for the so-called hospital crisis, then so be it. Thanks for watching, and our paper is available at cis.org.au.